My name is Barbara Fry, and I am the Program Director for Medical Laboratory Science Program at ODU. I've been here since 2016, and today I have three guests who will be sharing with you their experiences from Old Dominion University Medical Laboratory Science Program. Just to give you a very brief overview, medical laboratory science used to be called medical technology. So you may have some friends or family members or relatives who are already in this profession, but the name has changed. So sometimes when searching through different majors, applicants and students are not quite familiar with the term medical laboratory scientists. But this day and time, you may have heard about the laboratory professionals who work tirelessly in the hospital laboratory to help diagnose the patient and to determine whether the patients may be infected with an infectious agent, such as the coronavirus that we are dealing with right now. But we also perform lots of other laboratory tests, not necessarily dealing with infectious disease. And so I hope that my guests today will be able to tell you a little bit about this. I have two very recent graduates who finished the medical laboratory science program in December 2019. One is already working in the workforce. The other one just got accepted to a graduate program. So I hope she can tell you about this a little bit. And we also have our current student who is a senior. He will be graduating in December and is waiting to start his clinical rotations. So because we do have a clinical component in this program. And so I have a few questions that I will be asking my guests, who will introduce themselves to you, and hopefully this will encourage you to learn more about our profession and apply to our program when it's time to select this major. Tell us about yourself and why you chose a career in medical laboratory science. Christina, we're going to start with you.
So I have a degree in biology, and I was pre-med, tried to get into medical school, and that didn't pan out. And I didn't know what I could do with a degree in biology. So I started doing research, and I saw medical laboratory science, and I would get to play in a lab, play with microscopes, and that sounded like fun to me. So that's why I chose a career in medical laboratory science.
Amber, you want to add something?
Sure. So I personally chose medical lab science because I had always been interested in medicine. I just was having trouble figuring out my role, like where I would fit in best. I was working as a triage nurse for a local doctor's office, and I found that that environment just wasn't for me. I didn't like the direct patient contact at all times. So I did a little bit of research and found a more behind the scenes medical role for me would be best. So medical lab science just seemed to fit really well, and I'm really glad I did it because it's a lot of fun.
Taylor?
Yeah, so before my time at ODU, I was actually in the Air Force for 6 years doing public health. And during that time, I found that I really enjoyed the medical profession as a whole, but I wanted to do something a little bit more personally to me impactful. So I actually had the privilege of talking to my aunt, who's already a medical technologist, and I was able to pick her brain about the career field. And it really sounded like something that would stimulate my mind and would make me feel like I was doing a little bit more for the patient. So I went ahead and I started looking at what MLS programs were near me, and I found ODU, and here I am.
That's correct. And I remember that you actually first enrolled in MLS 210, which is the orientation to medical laboratory science, before you started the program. So you were planning ahead before you actually were interviewed and accepted to the program. You knew pretty well what the profession was about. So this ties with our second question that I want you to answer, which is to tell us about the day-to-day operations of a laboratory department and how do you see your role as the medical laboratory scientist in that department of the hospital. You can continue, Taylor.
Oh, I'm going to continue.
Since you're on.
Yeah. So yeah, as far as day-to-day operations of a lab department and overall the role of an MLS, it's really boils down to just one thing, which is to provide objective evidence of what is possibly incorrect with a patient by using different laboratory methods, right? So whether it be analyzing the patient's blood to see if they have an anemia, or if it's to take a throat culture and go ahead and see if they have like a strep infection or something like that. And then recently, obviously in 2020, we have our role is very intertwined with the COVID-19 pandemic. So we're also very involved with molecular methodologies with that. So ultimately, our job is to basically make sure that your doctor knows what's wrong with you so that the patient can be best taken care of.
That's correct. And we say actually that we estimate that way above 70% of medical decisions that are made by physicians are based on the data that are provided by the clinical laboratory. Christina, tell us about your day-to-day at the hospital where you currently work, as you graduated in December, so now you've been at the workforce for a while.
So I work in a stat lab by myself, and I run all of the tests that we offer in the urgent care setting. So it's easy for me to remember that every sample comes from a patient, and I feel like it gives a more intimate feel for the job. And these people who come in, they're sick and they want answers. The doctor looks to me for answers.
That's correct, because we always say that behind every specimen, there is somebody's mother or father or brother or child, right? And we always have to remember about this while we focus, on the other hand, on all the quality control of the sample that we use to perform the test. We always have to keep that in mind. Amber, did you want to add anything to this day-to-day operations aspect?
Sure. So I remember in my rotations, every time I would do a different subject, so either chemistry or micro, I would get really comfortable in one department and then I would go switch to another thinking, I got it. But your day-to-day operations are really going to vary by department. And my personal favorite was microbiology. I love playing sort of a detective role in trying to figure out what the organism is using your benchtop like biochemicals. I find a lot of enjoyment in that department. So I think once you start, you'll feel out where you belong and where you're going to enjoy yourself the most.
Right, and so we may actually tell the incoming freshmen that medical laboratory science is a very diverse field where we learn different laboratory testing in different sections, but ultimately the data that we provide to the physician may come from all these sections together, and they add up as pieces of a puzzle, so to speak, to provide best information about the diagnosis for the patient. So we do perform testing in clinical microbiology, like you said. We also perform testing in clinical hematology, where we look under the microscope for how the different blood cell types look like. Are there proper ratios of these cells maintained in the patient's blood, or are they different than their physiological norms? We also perform testing in clinical chemistry lab, which tends to be very automated. And finally, we also learn how to prepare different components for transfusion. So these are the four major areas, but as somebody already mentioned, in those areas, we may have some molecular tests that you need to be familiar with. We also perform a lot of tests that are based on immunological principles, such as antibody testing, for COVID-19, when we're trying to figure out whether the patient may have developed IgGs or IgM antibodies. And we also perform testing not only using blood and different body fluids, but also urine, which is referred to as urinalysis, right? Frequently a part of chemistry department or hematology department. Okay, so I want you to tell the incoming freshmen, what advice do you have for them as they consider this field of study, the field of medical laboratory science? We know that this is a tough major, so how would you encourage them to consider this and how to prepare for this? Amber?
So I would say that it's an incredibly rewarding field. It's a lot of fun, like I said. My advice would be to become friends with your classmates, because you can really lean on each other when you're studying, and you become the best of friends. And you know, it makes this, it's a difficult program, I won't lie. It's very, a lot of information in a short time, and having those people to depend on, it makes quite the difference. Another piece of advice I would say is to just, you know, get ready to study a lot. And like Dr. Cry mentioned, never ever forget that the specimen you're working with, there's a patient behind it.
Christina, did you have any advice?
My advice is to work hard and play hard because you are going to get frustrated. Like Amber said, it is a difficult program, but it's also rewarding. And treat yourself for your hard work.
Taylor, what is your advice? You just completed your second semester with the program and are waiting to start your clinical rotations at Veterans Administration at Hampton. So what advice do you have for incoming freshmen?
Yeah, so I have a number of different things I could recommend, but one of the best things I think is to remember that nothing that was ever worth achieving was easy. This program is very difficult and it will test you. You have to recall that for this, you have to know just about everything that could be wrong with a patient body. That's a very challenging thing to do, and is a very fast-paced program. It's evolving constantly, and it's very much going to be challenging your mental faculties. But like many of my other colleagues here have said, you're going to need to lean on your classmates. You're going to need to lean on each other. It is definitely one of those things that you have to remember that you're not alone. Nobody can make it in life by themselves, and that you can always look for help.
Absolutely. And it is probably worth mentioning that the class is relatively small, right? There are usually about 19, 18, maybe 20 students accepted to the program every year. So the students get to know each other very well, and they get to know us, the faculty, very well. Yes, it is relatively easy to reach out for help because there is not such a big mass of you as perhaps in some other majors. And Taylor mentioned that you have to, know all the different things that can go wrong with the body in order to prepare our applicants to this program. Of course, we require hard sciences, right, to complete as prerequisites for the program. So of course, anatomy and physiology 1 and 2 are just 2 courses that I'm going to mention right now, but you also have to have a sequence in chemistry for science majors, and of course biology with laboratory components, so that you are very well prepared for this. So yeah, maybe one of you could tell us about this. Amber, can you tell us about your experience with hard science prerequisites before you started the program?
Yeah, so like Dr. Cray mentioned, we did have to take a lot of sciences as prerequisites for the program, and I definitely struggled my most in organic chemistry. And the mistake that I made was, you know, I wasn't on top of my game at the very beginning of organic chemistry, and it just builds on the rest of the subject. So you need to, from the beginning, be prepared to learn the rest of organic chemistry. And I will say that given these prerequisites, it's going to really help you understand your courses in the MLS program. Biochemistry without a solid foundation in any of the other chemistries, you're really going to struggle. So I would say they're 100% necessary. And I know Dr. Cry mentioned there is like automation in the lab. There is a lot of automation, but you really have to grasp, you know, the chemical reactions that are occurring within your instrument. And if you don't know that, your interpretation of your result is going to be very difficult to do. So yes, definitely rely on your background in your sciences. There's a reason you took those prerequisites, and don't let it go just because you're getting into MLS. Definitely keep your notes with you and try and recall and make the connection between your MLS classes and your prerequisite science classes.
Right, that's very good. Yeah, so we do require foundations of chemistry 1 and 2, and then organic chemistry as well. And so I just want to mention that in College of Health Sciences, we have an excellent advising office. And so if you are interested in any health science, you need to reach out to the College of Health Sciences Advising Department, because they will help you select all those hard classes that you have to take and complete before starting the program. Because once you start the medical laboratory science program, your first semester is, guess how many? 18 credit hours, okay? So you really need to be ready to hit the ground running. And so if you have this good background in chemistry and biology and anatomy and physiology, this will make your life much easier in this program. And so we have 2 very heavy semesters. First, we start in the fall. We have lectures and laboratory exercises. And then the second part of the program are clinical rotations. What do I mean by this? This means that you as a student will be assigned to a clinical laboratory in the hospital setting, and you will be working on the bench alongside the certified professionals who are running those laboratory tests. You will be learning as you work with them in the lab for 8 hours a day, 5 days a week, 4 weeks for some rotations, 5 weeks in case of microbiology or clinical chemistry, because there is just so many tests to learn. And in some other cases, 2 weeks for blood bank, because we replace part of the rotation with exercises here on campus. So Christina, can you share perhaps your experience from your clinical rotations at Portsmouth Naval with our incoming freshmen, and tell them how it is to be a student in the real environment?
Everyone is really friendly for the most part, willing to answer any questions that you have. And the most hands-on part was probably my favorite, rotations. So micro, we got to actually plate the urine specimens, the wound cultures, the sputum, the stool cultures. So you got to see from beginning to end how those specimens are processed. And I don't know, identifying the pathogen as a student was really cool, but as a professional, I feel like it's rewarding.
Right, microbiology is very hands-on, right? Even though we do have some automation coming into the microbiology lab, very sophisticated sometimes, but you really have to have good manual skills. And since you started talking about specimens, let me just say it, you know, very straightforward. If you're easily grossed out, this is probably not for you, because some specimens are really gross. So you have to be able to get over this in order to success, to be successful in this program and do well and not being upset about everything that you get to see. Amber, did you want to share your experiences from your clinical rotations?
Yeah, so I was so scared. I was so scared to go into the rotations. I was nervous that people would be mean to me and I would ask stupid questions, but no, you have to remember that every scientist that's helping you and that's teaching you, they've been in your position. So first and foremost, of course, as much as I say, don't be nervous, you're going to be nervous, but it's exciting and it's fun to actually see what your day-to-day life is going to be. Again, my favorite was micro. I love the hands-on and just seeing the really seasoned lab scientists and how they can pick up on an organism with maybe one or two biochemical. Me, it would take an array and all these different maps, tried to figure it out. But it was awesome to see like how being in this field for so long can really turn on your instincts, and you know what's wrong with a patient, within a few minutes of testing the organism. I thought that was really neat to see.
Yeah, excellent. And so, of course, why do we offer this clinical rotations to our students? The main reason is so that we can prepare them to take the national certification exam upon completion of the program. Our program, of course, is fully accredited by the National Accrediting Agency for Clinical Laboratory Science. And because we are accredited, our graduates have the right to sit for the national certification exam as a medical laboratory scientist. And of course, you have two certified medical laboratory scientists here participating in this interview. And of course, Taylor will be sitting for the exam as soon as he graduates and submits all the paperwork to the American Society for Clinical Pathology to become certified. So why don't you guys tell our incoming freshmen also, do you feel that this program prepared you well for the workforce, or perhaps maybe for graduate school? What are your thoughts on this? Any takers?
I feel like this program 100% prepared me for the exam and for working. Definitely. Even in some of the classes, like you feel like you're not grasping it because it's moving so fast and it feels like you're treading water, but during your rotations, things really start to click. And since you're doing one rotation at a time, you have the opportunity to focus on that one subject. And I feel like it sticks better and you are kind of surprised by how much you remember. Even now, like months after graduating, I'll remember something and I'm like, why do I know that? How do I remember that?
Excellent. Amber, did you want to add anything?
Yeah, I completely agree with Christina. When you're in your rotations, you're just surprised at like what you can recall from your schoolwork, even though you feel like you were really overwhelmed, you were overworked, you were tired, but it really does stick. And when it came time for our certification, we were all really nervous, really scared, but definitely take it as soon as you graduate. I know Christina pushed me to take it a week after graduation, and I took it and I passed. But in other online forums that I'm in with other MLS students, some students didn't pass as easily, and I fully believe that the ODU program really prepared us for that certification and for that exam.
Excellent. So Taylor, this should all be very comforting to you, since you're about to start your rotation, because this is a really difficult year to be in the program, isn't it?
Yeah, it's definitely a challenge. It'll be interesting to tell my grandchildren about the COVID-19 pandemic, and your dad was going to change his whole entire career field, and then that happened. So it's definitely been a challenge, but I feel like we're all navigating it, students, faculty, and everyone, fairly well. I mean, we were fortunate that it impacted us kind of later into the semester, so we at least had a chance to put our hands on laboratory specimens and actually physically, have competencies drilled into us so we could actually put the concept onto a benchtop and see what was actually happening. So it was fortunate that this hit us all later in the game rather than straight from the beginning of the semester. Haven't even met any of the professors, and now we're all just kind of like meeting each other online. So I think we were fortunate given the circumstance.
That is very good to hear. Okay. Do you guys have any last thoughts? Anything that you would like to share with the potential applicants? Our program starts during the junior year, really, because all the prerequisites really add up to an equivalent of about 2 years. Because you have to have all the general education requirements completed. We also encourage everybody to have the option D courses completed as much as possible. But this is basically the third year. If you are starting at ODU from being a freshman, you basically are right now about 2 years before you would start the program. And so applications typically are submitted to us before February 1st of your sophomore year. So you really need to have your coursework lined up, hopefully with the help of the advisor from our wonderful advising office. So any last minute advice, Amber?
Keep going. You're going to want to stop. You're going to want to quit. You're going to be tired. It's worth it. I promise. Keep going. Surround yourself with positive people and positive friends, and just, keep going. That's all I have to say.
Believe in yourself. Know that you can do it. You were selected for the program. So there is something that you may not see in you, some kind of potential that you don't feel when you're struggling, but it's there, and you just need to channel it and keep going with your classmates or support system.
Taylor?
Yeah, so when you first start the program, I'd say for the first 2 weeks, and it doesn't ever really go away, but you're going to kind of have this idea of like imposter syndrome. You're going to feel like, man, am I here on accident? Is this a mistake? As you're starting to adjust to the new course load and everything. And if you ask everybody else around you, I guarantee that they're having similar experiences, right? So take it for what it is, take it with a grain of salt. Take solace in the fact that everyone else is pretty much going through the same thing, except for the rear oddity. And don't forget to have fun, okay? It's absolutely very possible to get so lost in the weeds and just like so serious and just get burnt out so quickly that it's so hard to remember yourself. And you absolutely need to take care of yourself just as much as you take care of everything
Absolutely. This is very true. And of course, unfortunately, being the COVID-19 class, you really haven't experienced this togetherness with the classmates as much as your previous class. But we do
staying connected. Actually, we've actually talked to each other. Zoom has been a really good platform to stay connected.
Right.
But yeah, it's definitely a lot of us were feeling bummed out that we don't get to see each other every day.
I miss everybody. Absolutely, every day. Now, I just wanted also to ask you about your experiences with our Medical Laboratory Science Student Association. So, because as a current class, you don't get to do as much, of course, as an MLSSA organization. Of course, we do have an annual blood drive, which is the largest blood drive on ODU campus, named after the former program director. And unfortunately, we had to, I don't want to say cancel, because I still hope that we will be able to actually have this blood drive later during the fall. So I want to say just reschedule. But Christina and Amber, did you want to talk about MLSSA and what you did as part of MLSSA last year?
Sure. So I don't know, we had a lot of fun with MLSSA. It was our baby that we try to make all these events for. We did a really fun Halloween event. we used it as an opportunity to educate the public and even your friends and family on what a medical lab scientist is, because I can guarantee you, once you start telling your friends and family, I'm going to be a medical laboratory scientist, they're going to say, oh, what is that? What do they do? And so that, that club really helped us, get the word out about the importance of our field, which it's incredibly essential. So we used it for that. Again, we used it to have fun, lots of pizza parties, right, Christina?
Yes, that's why I went.
We did a t-shirt. That's what Christina and I are wearing now. So yeah, just a lot of it gave us a chance to kind of kick back. Like Taylor said, it's important to just de-stress, and MLSSA was a good way to do that for our class.
Now the current class president, so if any of the freshmen were interested in joining MLSSA, perhaps learn, what the medical laboratory science profession is, and what do the students enrolled in this major actually do.
You don't have to be in the program to join,
right?
But it is a great source of information.
Yes,
absolutely.
Everyone should join.
And networking.
Yeah.
And networking. That's correct. That's correct. Well, this is excellent. So thank you so much for sharing today your experiences with the program. I wish all of you the best for the incoming summer. If you have an opportunity to get some rest, please do. Some of you will be working hard towards last prerequisites for the graduate school, right? And then some others will be working on, learning new experiences in the laboratory. And some will be preparing for the clinical rotations as part to finish the program this December. So I wanted to thank you very much. It was great to see you, and stay in touch.